Well, hello and welcome to another edition of Health Solutions. Shawn and Janet Needham Care. I am your host, Shawn Needham, along with my producer, Lindsay, and we are streaming from wonderful downtown Idaho Falls, Idaho. Love it here. Beautiful, gorgeous, high mountains and mid-high mountains, I guess, and great weather. It's still kind of cool. It's sunny outside and we're loving it. So today, you don't want to miss today's episode. Stay till the very end. There's going to be a lot of stuff we're going to talk about in 30 minutes. We are honored to have a wonderful guest, Dr. Ken Fisher. He is a retired nephrologist. He focuses on healthcare policy. And just recently, as in just yesterday, there was an article in the Wall Street Journal about the COVID-19 virus and where it came from in the Wuhan lab, and possibly if it was man-made and funded by the U.S. government. So, Dr. Fisher, without further ado, tell us about that article and how you can relate to it.
Well, I think first people have to understand what gain of function research is all about. So it sounds like a benign kind of thing, gain of function. Well, how bad could that be? But what it really means is you take a virus in the lab and you engineer it so that it's more potent in infecting humans. And this kind of research has been going on for about 5-10 years now, and is majorly funded by the National Institutes of Health under the direction of the chief of infectious diseases at the National Institutes of Health, Anthony Fauci. So this is an amazing coincidence. So so there are a few questions. One question, the main question is, should the NIH be funding gain of function research, which is actually producing in level 4, which is supposedly the safest level of labs, from which there have been many leaks in the past? Should they be functioning this kind of work? And question number 2, should they be funding this research outside this country? So, so it turns out that let's see if I could find about approximately 10 years ago, there was an article in the Washington Post written by Dr. Collins, who was the head of the NIH, who, as you might recall, was the key person in finding the human DNA code. So that's how he became world famous, and he became the director of the NIH. He and Tony Fauci and one of Tony Fauci's assistants wrote an article in the Washington Post that, yes, gain of function research is worth the risk. And then other scientists pushed back, and the NIH determined, made a moratorium on research, on funding of research of gain and function research using viruses. Then that was in 2014. Then 3 years later, they said, well, Dr. Collins published an essay on his website saying we're going to renew gain of function research. And it also turns out that they funded a fellow by the name of Peter Danzig, who is a bigwig also with the WHO, to go around the world and search for viruses, coronaviruses and other viruses. The virus we have that is causing this pandemic is a coronavirus. It's an RNA virus versus a DNA virus. So,
which means, so for our listeners and viewers,
yes,
why is that important?
Well, RNA viruses are more likely to mutate they're not as permanent as DNA viruses. So you can play with them in the lab a lot more. It's a
I
lot
see.
easier. And what you can do is um, you can pass the virus into certain animals, especially a ferret, which sort of has a lot of things like a human in their lungs and stuff like that. And you do serial passages in the ferret so that the RNA virus, which mutates a lot, then adapts itself to the ferret, which at the same time is adapting to humans.
Right.
So you have to ask yourself, why would you do this? Why would you deliberately make a virus that would attack a human? So the rationale, which was never proven and is now disproven, was that, well, if you make the virus so that it'll from an animal that will attack a human, if it were to occur spontaneously, you would know how to fight it. Well, okay, it sounds kind of reasonable, but it's totally not reasonable because you cannot predict how the virus is going to mutate in an animal. So what you do as a human to pretend that it's going to mutate like you made it mutate is sheer folly, because the possibilities are in the billions. There's no way you're going to guess how it's going to mutate in an animal so that eventually it'll attack a human. So so I got interested in this, and is it possible that this the pandemic we're going through now was funded in part by the NIH in a lab in Wuhan, China? Now, the lab in Wuhan, China was recently built. It's supposedly a level 4 lab. And what level 4 means, that it's the safest possible it can be. Well, it's a brand new lab. They didn't have the help, the trained help, to be able to make it as safe as possible. And there were even cables from the State Department, from the embassy in Beijing. They went to this lab 2 years ago in 2000, I believe in 2017, could be 2017, 2018. And there's an article in the Wall Street Post by one of the people. So they wired back to Washington that this lab is anything but safe, that the crew is ill-trained, they didn't have enough funds to do it right, and these cables have been squashed. So one of the diplomats had to send the cable to a Washington Post reporter, who then put it online. So during the pandemic, I write an article every 2 weeks for Authentic Medicine on health policy. So I decided to dig and find references about all the moratorium, why some virologists said you cannot do this. This is ridiculous. And so the NIH did a moratorium, and it was during the Obama administration, and it might have come from Obama himself. I do not know. But then they went back and kept on funding. So one of the things I would like people, the government, to do is to just follow the money.
Yeah.
How much money has the NIH put into gain of function research all over the world, including in the United States? Because one of the major labs that the Wuhan lab works with is in North Carolina. And those two, the Wuhan lab and the North Carolina lab, published a paper in 2015 showing a combination virus. They created a combination virus of the one from the bats in China, which is about 600, 800 miles from Wuhan. So there's no way it just walked there.
Right.
And they published this paper in 2015 showing that they could combine this virus with this virus from the bats with another virus that infects humans. And you say to yourself, how in the world would people do this? As a matter of fact, the virologist in France wrote that this is crazy. This is sheer folly. Why are you doing this? So those two labs. So how much money has the NIH spent on gain of function research in total? How much have they spent outside this country? And they're also funding this guy, Peter Danzig, who is tight with with the Chinese Communist Party, who runs
Wow.
an entity called Eco Health Alliance in Manhattan. They fund him, and then he sends some of the money to the Wuhan lab, and other monies he uses to search for these viruses in animals all over the world. So, to make matters even more bizarre, the WHO just published their report. Well, Peter Danzig was a major part of that group that went to investigate the cause of the source of this virus in Wuhan. So of course he fudged the whole thing because he's funding it.
Right.
And there was another member of that WHO group that just published from a Dutch lady who also does gain of function research. And many of the scientists who write, oh, it couldn't have come from the Wuhan lab, also do gain of function research and funded by the NIH. So you have a core group of people who have been doing this for the last 10, 15 years, funded by the NIH, and surprise, they want to keep on getting the funds. Boy, that's a shocker.
Right. They've got vested interest in this, so they don't want anybody
That's
to think
right.
that the U.S. was funding something that caused this. Is basically what you're saying, correct?
Correct. And so yesterday, which is a coincidence because, we arranged for us to be, for this program weeks ago.
Right.
Yesterday in the Wall Street Journal, they're saying the same thing.
Yeah.
The main editorial, the Wuhan whitewash, it pointed out that two of the people in this group were actively doing gain of function research, including Peter Danzig, who organized a group to write in Lancet about a month ago. Oh, it's impossible to come from the Wuhan lab, and people actually believe him. And he's the guy.
Can we stream that article?
What's that?
I'm talking to our producer. I want to stream the article up there so we can have it and make sure we put it in the show notes so people can reference it. The Wall Street Journal article.
So what they also want to be able to reference, I think, is my article in Authentic Medicine.
Correct. So here's the article you were discussing. You were discussing that came out yesterday in the Wall Street Journal. It was perfect timing for our podcast. If anybody already,
it's unbelievable.
Yeah.
And in that article, they point out that Tony Fauci has been funding gain of function research for years. They point out that the WHO team was compiled of people who are actually doing gain of function research, led by this guy Peter Danzig, who's a PhD and goes around the world looking for viruses. And of course, he wants to continue doing that, right? Like anybody else.
Right. Vested interest.
Yeah. So a lot of the people commenting on if the Wuhan lab is the source of this pandemic have a conflict of interest.
Right. So let's go ahead and put his article up, producer, and tell us, when did you write your article?
Well, let me look.
Yeah.
February 10th.
And what journal do you write for in that? You write every 2 weeks?
Authentic Medicine. Oh, there it
Okay.
is, right there.
Yeah.
Yeah, Authentic Medicine.
So you wrote this before that article came out in the Wall Street Journal, and it sounds like
About a month plus
right,
before,
right.
and
Okay.
it's it's amazing. There's a lot of problems with Google, but one
Yeah.
of the things you can do for Google is you can find just about anything. So, I had this idea when I wrote my article in Authentic Medicine. I've got to research this. What is the NIH doing? And that's where I found the article in 2014. I'm sorry, before 2014. I don't know the exact date.
Mhm.
Where Tony Fauci and Collins and another fellow who works for Fauci said during a H1N1 epidemic, thinking about a possible epidemic for H1N1, which is another coronavirus, virus.
Right.
No, I'm sorry, it's not. It's not. But they wrote that
Okay.
that the gain of function research on that virus is worth the risk. And when Collins reinstated funding from the moratorium, he said these labs are absolutely safe, which is totally false. There have been hundreds and hundreds of leaks from level 4 labs in the United States, never mind from around the world, never mind from a new lab in Wuhan, China. Now, why is Wuhan, China so important? Wuhan, China is so important because the lady who runs that lab has been collecting bat virus coronaviruses for the last 10, 15 years and has learned molecular biology to alter that virus and get funding for doing gain of function research on the bat coronavirus that is the that this virus is a descendant of. So the virus from this pandemic was originally worked on by this lady in the Wuhan lab, and with help from the lab in North Carolina, has been doing gain of function research on this virus. So one has to ask the question, what is more likely? A leak from this lab, which the Wall Street Journal piece yesterday says there's intelligence that some workers from that lab got sick in the fall of 2019 before this thing spread around the world. So what are the odds? Did it come from those people who got sick working in that lab, which the State Department had already said is not safe? Or did it come from frozen food, shipped from outside China
Right.
into China? Or did it come from some intermediate animal that nobody can find? So this is all speculation.
So let me just clarify some things. Thank you
Sure,
for that. That's very educational, and I really appreciate it. You're obviously very knowledgeable on this subject. I'm sure our listeners and viewers really appreciate it. So a couple questions. So as of now, the federal government doesn't admit at all to doing gain of function research. Is that true?
I can't say about right now.
Okay.
I've read that there's a possibility that they stopped funding recently, within the past few months.
And
But I'm not sure that's true.
right. And there's a lot we don't know about this, and it just seems like there's a
Right.
lot of secrecy going on and non-transparency. And from what you're telling me, right. And I think that's the whole purpose of having this conversation, so we can educate our viewers and listeners so they can make their own decisions. So does the U.S. federal government even admit to funding the Wuhan lab as of now? Has that came out? I mean, at first they talked about it when the pandemic first started, but now I don't know. Where does the federal government stand on that? Do we admit that we've given money to them? Does our government admit that?
Well, I have a reference in this article that I wrote in February that talks about that 2015 article in Nature Medicine and puts a footnote on that it was funded in part by Eco Health Alliance, which gets funds from the NIH.
Okay.
So the editors of Nature Medicine said it, but has the NIH said it?
Right.
I am not aware.
Right.
I am not aware of them saying, well, folks, we have funded gain of function research. Now, there was also one of the key pieces in this was a piece in the New York Magazine in January that sort of blew the lid on this and got me going on trying to research this. This fellow did a tremendous job in the New Yorker, 30 some odd pages. I can get you the references in a minute. I'll have to fumble through all my references.
Yeah, you can just send it to me and we'll put it in our show notes. I'd appreciate that.
Sure.
Yeah. Along with all these other references that we put up on the screen, we'll put those in the show notes.
Sure.
Our editor needs to, I'll let him know that.
Right. So this fellow wrote, it's about a 30-page article. It takes a lot of patience to get through it. It's technical. But that started this whole thing, pointing the finger at, well, what's going on here? As far as I know, Tony Fauci, who's been a spokesman about this for months now, right, has never in public in the past few months said, well, we have funded research that could have led to this. Hasn't said.
Right.
Which is, duplicitous in my mind.
Yeah.
I'm not saying the guy isn't a brilliant guy. I'm not saying that he did a great job with HIV. And he's done a lot of terrific work he's 70 plus years old. He's a little younger than I am. But, sometimes people with tremendous gifts make mistakes. Nobody is infallible.
Well, and you already kind of said it earlier, and I'm not suggesting this. I'm just saying it could be a possibility that,
Right.
I mean, follow the money. I mean, you already talked about following the money, and that's really, that's what needs to be uncovered is follow the money on this stuff. Because if we follow the money, we'll probably find out a lot that's going on. Now, speaking of that, what would be, Dr. Fisher, in your opinion, what would be the only reason to do gain of function research? Biological warfare? Seriously.
Well, that's very interesting. You should ask that question because it's called dual function research by an executive at the NIH. It's called dual function. And so, for weeks, I'm reading dual function. What in the world, does that mean in government speak?
Right. I don't know. Right.
Well, it means for weapons, biological weapons. That's one function why you do this. The other is this excuse that, well, you'll learn more about viruses that attack people and you'll learn how to fight it, which of course is totally disproven by this pandemic. It was of no value in fighting this virus. Right. The only thing that really fights this virus is a vaccine. And you could, one of the things that I think people don't understand, the regular test they did with, where you stick a bunch of cotton swab up somebody's nose.
The PCR test or whatever.
Yeah. That's the PCR test. Mm-hmm. Well, it's an RNA virus. So you use something called reverse transcriptase to make it into DNA. You then take apart the DNA and you say, oh, somebody has this virus, right? And I mean, we've been doing that from the day one. Of course, the initial test from the CDC was a flop, but the one from Korea worked well, from South Korea. So finally, the CDC in the United States, they only have a $6.5 billion budget. They had to go to private industry to make the test. But you would find the molecular structure of that virus, the genes that direct the creation of that virus, within minutes, within a day of when it first appears. There was no need to do gain of function to learn the genetic code of the virus.
They could have found it right away.
Right. Well, the test that we've been doing since this pandemic started is to detect the genetic code of the virus. So, of course, once you have the genetic code of the virus, you know, companies like Moderna and Pfizer can say, oh, okay, the protein that, you know, once you have the genetic code, you know what the protein looks like.
The spike protein, correct? Yeah.
Right. You can then make a spike protein wannabe and give it to people, and they'll be immune.
Right.
Edward Jenner, you know, started immunology in the late 1700s, finding out that cowpox will protect people from smallpox. Right. So, I mean, this is one of the greatest advances man has ever made. You know, before, smallpox would kill 30, 40, 50% of the population. It probably wiped out 90% of the original people in the Western Hemisphere.
Yeah.
Smallpox. So, I mean, we think this virus is terrible. It's a piece of cake compared to smallpox.
Right.
So, I forget where I was going with this, but the whole thing is, but yes, follow the money.
Yeah.
And that's what I've been asking. How much money has the NIH, but it's not only the NIH, it's the Defense Department. There are other agencies that I mentioned in the paper.
Well, probably the WHO, right? And CDC, maybe. You know,
who knows?
Right.
Who
I mean,
knows?
and that's just it. You asked the question, who knows? That's what we should really know.
Exactly.
I mean, you know, follow the money. Who is funding this stuff, and where was the Wuhan lab funded from? Where did this virus come from? Did it come from the Wuhan lab? And let's just be transparent about it. I mean, the public needs to know.
Well, a lot of the records of the Wuhan lab have been destroyed. Boy, that's a real surprise that the Chinese Communist Party,
right?
You know, and this lady has recently said, excuse me, the woman that runs the lab, there's been no military work in this lab, when actually there are papers in existence that show there's been military work in that lab. Dual function, remember?
Dual function. Yeah.
Dual function. So let's see if I can. I'm looking for an article from an executive at the NIH, who in the last paragraph says this was a total waste and a total mistake, and it didn't help work. It didn't help work fighting this virus at all, and we should never have done it. That's from an executive at the NIH.
Wow. If you wouldn't mind sending me that, I can put it in our show notes. If you find
I'm
it.
looking for it. I have all these papers all over the place.
Yeah, you do a lot of research. It's obvious. You're very well educated on this.
I have the paper right here. Let me read the last paragraph. It's from a fellow by the name of Carl Sorokin, Sirotkin. And Dan Sorokin, which I'm assuming is his son.
And what's the title of the article, Dr. Fisher?
Might SARS-CoV-2 have arisen via serial passage through an animal host or cell culture?
Okay.
Gain of function research. So let me read the last paragraph. And the last paragraph is amazing. And whether or not gain of function research is determined to have played a role in SARS-CoV-2 emergence, the fact that it creates opportunities for pandemic viruses to leak out of labs calls for a reevaluation of the moratorium against this practice because the emergence of this novel coronavirus has demonstrated that the international public health community is not prepared to handle the leak of a pandemic virus. Furthermore, none of the gain-of-function research conducted since 2014 has provided humanity with any tools at all to fight back against the ongoing pandemic caused by this novel coronavirus. This is an executive at the NIH.
Wow. Wow. Thank you for sharing that.
I mean, so I mean, and also there's another point that I've written about in Authentic Medicine, and that is every virus has its own footprint. So the pandemic in 1918 to 1920, which killed about 500,000 Americans and about, I don't know, 5-10 million around the world, affected people mostly aged 20 to 40. And in my opinion, that's one of the reasons we had a depression, because it killed people in the 20 to 40s in the mid 20 in 1918 and 1920. So those people were the major consumers in the late 20s, and we overproduced, and
Right.
we had the Great Depression. Now, whether that's, I'm not an economist, and whether that's right or wrong, I don't know. But each virus affects the population in a specific way. The flu that we get every year or every other year affects mostly young children and old people. So what is the demographic affected by this coronavirus? The demographic affected by this coronavirus is mostly people over 55 or people with serious health conditions.
Right.
Okay, so practically all the deaths are people over 55 and younger people with serious disease. So why? When this, and was this known early in the pandemic in the United States? And the answer is yes. There was the aircraft carrier Theodore Roosevelt, which you might recall, that the captain was thrown out of the Navy because he had about 1,200 people infected with this virus. He thought they were all going to die. So he took the carrier out of the, off the line, and he went to Guam and got these people off the ship. One died for a death rate of 0.1%, which is about the same as the flu.
Right.
However, there were nursing
Right.
homes in the state of Washington at the same time where flocks of people were dying. So we knew.
That's my home state. Yep.
There you go. So then we knew the demographic affected by this virus.
Right.
So why didn't we pay extra attention to the people who were vulnerable, people in nursing homes, chronic care facilities, needed unbelievable careful care? Because once that virus gets in there, it's going to kill half the population. So, and then let healthy young people who can carry this virus, spread the virus, but don't get sick. So why do we keep them from working? Because we wanted to stop the spread of the virus, right? But what people didn't realize, and what the group who did the Great Barrington Declaration, which you go to just greatbarringtondeclaration.org, they did antibody studies that showed the virus was already widespread within the country.
Right.
so that closing the country down would not work. Lockdowns could not work
Right.
because it was already there. So, so you have, to me, you had worldwide hysteria, and so instead of people who have been trained taking care of patients saying, well, who is this virus affecting? You had epidemiologists who had never taken care of patients, even if they were MDs. They never took care of patients.
Right.
So they didn't think that way. They thought, well, we have to stop the spread of the virus. But what the Great Barrington Declaration people, and especially a fellow Bhattacharya or something like that, I can't pronounce his name, he is a very special character. He got an MD from Stanford, then he got a PhD from Stanford in economics. This is a bright man.
Right.
So he, early on, developed an antibody that was specific for this virus. And he went to one of the cities in California, and he found that 15% of the people had already had the virus, even before anybody knew that it was around. So how in the world can you stop the spread when 15% of the population already has it, most of whom are asymptomatic but can spread the virus? So lockdowns, and I've written about that, lockdowns made no sense.
Right.
If
Yeah.
you understood the footprint of this particular virus, everyone is different. So that also troubles me tremendously.
For
So
sure.
So
Yeah.
the whole world is hysterical over this thing, and it's run by epidemiologists who are not physicians and don't take care of people and don't ask the
Right.
question, who's at risk? So
Well, thank you for all that. There's a lot of good information there, and we've got a lot of references that we're going to put up in our show notes on these on this podcast. So, as we're wrapping this up, tell us about your book. You've written a book. You're an author, so tell us about your book.
Well, that book, what I wanted to do is to trace where the idea came from that instead of funding people who can't afford it, give them the money to to run their own health, that indeed you needed a government, huge bureaucracy to do it. Where did this idea come from? Well, the idea came from Otto von Bismarck in Germany in 1888, that he wanted to take care of poor people, give them health, because Karl Marx and Engels were making a big fuss within the country, within Prussia, and that, and then he unified, Germany with the Franco-Prussian War. He was a prince, and he was prime minister of Prussia, and so he started this kind of centralized system. And of course, at that time, that you couldn't issue a credit card, right? That would be for health only.
Right.
So where did this idea come from? Well, that's where it started. And then George Lloyd, who became prime minister of Great Britain as head of the Liberal Party, he copied that system for Great Britain at around, 1890, the turn of the century. Mm-hmm. So, and they developed this huge bureaucracy. So then at the end of World War II, after people just got demolished in Great Britain, right? Just demolished, the Labour Party instituted it for everybody. A high bureaucracy. The government runs the hospitals. The government runs the doctors, et cetera, and that's where it came from. So we, in this country, And then I go into, how the AMA was founded, and it was founded originally by a unbelievably uh, brilliant man, Nathan Smith, who founded the Northwestern School of Medicine, founded the Northwestern School of Law. I mean, this guy was an intellectual giant. He founded the AMA and the AMA came into existence just as scientific medicine came about with Pasteur and the germ theory of disease, et cetera, et cetera. And so he started the AMA, and initially the AMA did great stuff. However, they got fixed on only that the patient has to pay the doctor. That's it. There are no other alternatives. So people who were poor and the elderly and this, that, and the other thing. So Lyndon Johnson did the election in 1964, just wiped that out, right? And he started Medicare, Medicaid.
Yep.
Well, actually, it was started by the head of one of the committees in Congress, and so and who developed it in 2 days, by the way.
Wow.
So we're stuck with this thing, and the bureaucracy gets bigger and bigger.
It
So
does.
now we have industrialized medicine. So the patient is just a tool by which to develop a bill, and it's to me
that's a great analogy. That's really what it is. Yeah.
And why we do this is because Otto von Bismarck came up with the idea over 100 years ago. Is just plain silly. Fund the patient. If the patient doesn't have the money, give the patient the money. And of course, everybody spends their own money much more carefully than they spend everybody else's.
Exactly. Right.
And so our system is totally out of control with cost. Middlemen are everywhere, just sucking billions out of the system. And so I wrote this book is to say how we got here, and I follow it through all these major phases, and I follow how the AMA got totally co-opted by Lyndon Johnson. So now it's really a tool of the government, and why it, and I follow the money as to why it is a tool of the government. And so the whole thing seems rather ironic. And there was a plan in Indiana by Mitch Daniels, who I wish had run for president, but didn't for reasons that we're not going to talk about. And he started the Indiana plan where he funded Medicaid patients. And guess what? Gave them the money the first time they ever had a bank account in their life. Emergency room visits decreased by 75, 80%. Costs decreased by half. And of course, it was squashed by the federal government.
Of course. So that's a good, I mean, it sounds like a great book. What's the name of your book? Understanding Healthcare, correct?
Understanding Healthcare, a Historical Perspective. How did we get here? And how can we get out?
Right, by Dr. Ken Fisher. All right, well, thank you for that. And so that's a good segue into my book, because there's a lot of similarities in my book. I wrote a book called Sickened: How the Government Ruined Healthcare and How to Fix It. And I'm pretty optimistic. I'm still practicing in healthcare, and I'm pretty optimistic that there is a fix. And really, kind of like what you're saying, patients need to be in charge of their own health. That's the fix. I do talk about a 6-step solution. But the first one is patients need to be proactive in their own health and healthcare, and that includes financially. They've got to be financially vested, period.
No question. Absolutely right. And this distortion is hurting industry. During World War II, that was another accident. I go into that, how it turns out that corporations are funding people, their employees' healthcare, but not directly. They don't put the money into the person's account. they hire a insurance
Yeah.
company, which is sucking up most of the money, right?
Yeah.
So, I mean, you have all these accidents of history, and it's just destroying us.
That's right.
Um, it's so strange, and of course, people, the politicians who are always, oh, I'm helping you. So, like for instance, the politicians believe that they have to control healthcare because individuals can't, right? Oh, individual doesn't know.
Right.
So,
Right.
but they give people food stamps,
Right. Right.
they give them cash, but of
Right.
course, food is not as important as healthcare. I mean,
No,
without
exactly. I love it. I love it. You were preaching the choir, Dr. Fisher. You were preaching the choir. So,
it's
and that
unbelievable.
also reminds me we are running out of time. So,
Okay.
um, let's finish up the conversation. My question for you is, what do you have a passion for? What drives you?
I went to college as a chemical engineer, and I got appendicitis in the summer between my junior year and senior year in college. And I asked the physician to explain to me how he's making the diagnosis, what it means, how it works, how can a blockage in my appendix, cause me to die, you
Right.
know? So it just fascinated me. It just, the molecular biology just fascinated me. And I love medicine. And I love medicine to be able to take care of people as human beings and connect with people. And that's the joy. And this government is taking the joy out of being a doctor. Physicians spend 50% of their time on a lousy computer system
Yep.
that
Yep.
costs a fortune when you can get a very good computer system from Atlas MD for $3,000 a year.
That's right. Yeah, I get it. I get it. So
It's
we
not
preach
the
to the
idea
choir,
that,
Dr. Fisher.
right?
Yeah.
It's not that computers are bad.
Right.
It's the
Right.
system that's bad.
Yeah. So speaking of systems,
Yeah.
Monday, stay tuned for our show because we will have a patient on who had kidney stones, and he's going to talk about how difficult it was. He was in horrible pain, how difficult it was to access care. Horrible. So not only was it difficult to access, it became expensive, and it doesn't have to be. We will have a urologist on the call with us to kind of guide us through the system about how it should have been taken care of. So tune in for that. That's going to be at 2:30. Normally we stream at 12:30 Pacific Standard Time, but tune in for that 12:30 Monday. And
You're going to send me the link, right? You're going to
I
send me
can. I sure can. Yep.
right.
And as always, we do have our Thursday podcast normally at 8 to 9 a.m. Pacific Standard Time. And that about wraps up the show today. So, Dr. Fisher, I thank you so much. There was a lot going on there. And if for anybody that might be a little bit confused or wanted more information, because I definitely do, we're going to put links in the show notes on the podcast today. So there'll be links to these articles, and it'll be much easier to do more of your own research. So, Dr. Fisher, you're obviously very passionate about the subject. You're obviously very knowledgeable. I appreciate you being on the show today. Thank you so much.
It was a pleasure, Shawn, to be on the show.
Thank you.
I
And listeners
really
and viewers, thank you. And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Monday. We'll see you later.